Hello class, welcome back to Foundations of Structural Kinesiology. We're going to go into day 2. Today we'll talk about the planes of motion. So imagine planes as an imaginary two-dimensional surface through which a limb or body segment is moved. Now, motion through a plane revolves around an axis. So on the test, make sure you know the difference between an axis and a plane. So there's a 90-degree relationship between a plane of motion and its axis. And it's easy to get these questions wrong on the quiz, so spend some time on this part. So let's look at the planes of motion first. So you've got the anterior-posterior or sagittal plane. Then you've got the lateral or frontal plane. And then you've got the transverse or horizontal plane. So if you look at the sagittal plane, right here, and that will take you and divide it into right and left. Okay. The frontal plane will divide you into anterior and posterior. Okay. And then the transverse plane will divide you into superior and inferior. Now what you want to look at is what is the axis. Okay, so the axis is different, and we'll talk about that as well. So let's look at just planes. So sagittal plane right here, the mid-sagittal plane right down the middle will divide you into right and left. But you can have a parasagittal, which is right down here, and it might have a little bit of this upper extremity and a lot of the rest. So you can see that, but a mid-sagittal plane right here, okay, divides you into right and left. The frontal plane, or the lateral, will divide you into anterior and posterior. Okay. So you have to look at what it's dividing, and those are easy ways to look at this. Now, if you look at the sagittal or anterior-posterior plane, okay, it bisects the body from front to back and dividing it into right and left symmetrical halves. And so what are some exercises that you would do in the sagittal plane? Well, sit-ups. Sit-ups would be a good example of what you would do in the sagittal plane. Unfortunately, when you go to the gym or when you do certain exercises, you only focus on one plane of movement, and that is not successful. We want to train athletes in all planes of movement. So we want to find exercise in the sagittal plane, the frontal plane, and especially the transverse plane, which is cutting and running. Okay. Now, if we look at the frontal plane, lateral or coronal plane, that divides the body into anterior or front and posterior back halves. So what's an exercise that you would do in the coronal plane or the frontal plane? That would be jumping jacks. So remember these and try to, or lateral raises, right? Lateral deltoid raises. Hip abduction, adduction, that's in the frontal plane. Now if you look at transverse axial or horizontal plane, that divides the body into superior top and inferior bottom halves, spinal rotation. But the lack of ability to move in the transverse plane leads to a lot of issues, and a lot of times it comes from the hips and the thoracic spine. So you want to have good mobility in the thoracic spine and the hip to prevent injury, and we'll talk a lot more about this throughout the semester. Now, the diagonal plane involves a combination of movements from traditional planes and occurs in joints that are capable of movement in two or more planes. So that diagonal movements will occur in the frontal plane, sagittal plane, transverse plane, two or more movements. It can occur in all three planes. So an example of a high diagonal and the two low diagonal planes. So if you look at this, if you look right here, and right here. So if you look at sports in general, they all involve diagonal planes of motion. So if we don't train our athletes, if we don't train our patients in diagonal planes of motion, they're just going to have injury again. So you cannot go and do rehab in just these simple sagittal, frontal, or transverse planes. We must combine them and be able to move through all three planes of motion to prevent injury. Now, if you look at this high diagonal, upper limbs of the shoulder joints, overhand skills, the baseball pitch is a perfect example of the high diagonal. Boom, 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 boom. And we'll look at the high diagonal and the torque that it places on the elbow a little bit later on in the semester. But just understand that the baseball pitch is a good example of the high diagonal. Now the low diagonal, lower limbs at the hip joints, so kickers in football, that's a low diagonal. And then golf is a good example of the low diagonal here. If you look at Tiger coming in, boom, boom, and the follow through. So for movement to occur in a plane, it must turn or rotate about an axis that has a 90-degree relationship to the plane. And the axes are named in relation to their orientation. So this is where it gets tricky. So don't miss the difference between an axis and a plane. So if we look at axes of rotation, so the frontal, coronolateral, or mediolateral axis, okay, so it has the same orientation as the frontal plane and runs from side to side at right angle to the sagittal plane of motion. So it divides the medial and lateral, commonly includes flexion and extension. So the axis, right, so imagine the axis going right here, right? So you're bisecting it this way. Here's the axis of rotation. So if I have like a little screw right here, it will allow me to go into flexion and rotation. Remember, the axes are 90 degrees to the plane. So a motion that occurs around the coronal axis or the frontal axis is flexion and extension. Now, if you look at the sagittal or anterior-posterior axis, okay, has the same orientation as the sagittal plane of motion and runs from front to back. So a common exercise or a common motion that occurs around the sagittal or anterior-posterior axis is abduction and adduction. Boom and boom. So that would be deltoid raises, right, lateral raises. Now vertical or long axis, the axis is going to go down. And what are the motions? Internal and external rotator. So you can have internal, external rotation of the shoulder, internal, external rotation of the hip. And I will tell you now that the key to a lot of injury prevention is training our athletes or our patients in this transverse plane along the vertical and longitudinal axis. The ability to rotate internal and external is key. When you put it all together, diagonal or oblique axis runs at a right angle to the diagonal plane. Okay? And this is when it gets a little tricky because you have to combine all three planes of motion and all three axes. Now, as we go into the body regions, you want to make sure that you're able to describe something very specifically. And you might see in the medical chart that someone might say the cubital fossa. You're thinking, oh, cubital fossa, where's that? Well, you should know that the anterior cubital fossa is in front of the elbow. If they say the inguinal area, you should know that that's in the groin. If somebody says popliteal fossa, you should know that that's in the back of the knee. So if all of you have taken anatomy, so this should be just a review for you. If you didn't do so well in anatomy, then you might want to make some flashcards and refresh, because some of these might show up on the quiz or the exam. Now, axial means cephalic or head, cervical or neck, and trunk. Okay, so in the axial region we have the cephalic or head, cervical or neck, and the trunk. The appendicular area are the upper limbs and the lower limbs. So if you remember from anatomy, when you studied the axial skeleton, you studied what? The skull, the spinal cord, the ribs, right? When you studied the appendicular skeleton, you studied the upper limbs, the arm, the forearm, the carpal bones. The lower limbs, you studied the femur, correct? Tibia, fibula. Now, the cephalic or head in the axial region, that's the cranium face. Cervical also means neck. And the trunk, that can include the thoracic, dorsal, abdomen, abdominal, or pelvic and pelvis. So essentially the pelvis is part of the axial skeleton. The pelvis is actually made up of 3 bones called the os coxae, and we'll talk about that more specifically a little later on. The appendicular are the upper limbs, the shoulder, arm, forearm, and manual, which are your hands, and then the thigh, leg, and pedal, which is your foot. So again, this is just a review of anatomy. We don't need to spend time on learning every single bone. You should know all these bones already. Now here's some interesting facts. The adult human body has 206 of them. There are 26 bones in the human foot. The human hand, including the wrist, contains 54 bones. The femur or thigh bone is the longest and strongest of the human skeleton. The stapes in the middle ear is the smallest and lightest bone of the human skeleton. Arms are among the most commonly broken bones, accounting for almost half of all adults' broken bones. The collarbone is the most commonly broken bone among children. So how many of you have had a broken bone in your childhood? Go ahead and write that in the comment section or the chat section. Any bone that you've broken, go ahead and write that. Bones stop growing in length during puberty. So bone density and strength will change over the course of life, however. The only bone in the human body not connected to another is the hyoid bone. So it's a V-shaped bone located at the base of the tongue. And bones are made up of calcium, phosphorus, sodium, and other minerals, as well as protein, collagen. Now, osteology, just a good review. The adult skeleton has approximately 206 bones. The axial skeleton contains 80 bones, and the appendicular skeleton contains 126 bones. So exact number of bones as well as other specific features occasionally varies from person to person, but most likely you have 206 bones in the human body. Now, did you know that essentially we're just part of 4 races? Right? People always say, hey, where are you from? Where are you from? And really, if you look at the cheek structure of most individuals, you really fit into one of 4 races. So you're either Caucasian, you're either Mongolian, you're either Negroid, or Australian. So they say, hey, if I'm Indian, I'm looking at this and I'm saying, wait a second, I'm either Caucasian, Mongolian, Negroid, or Australian. So it really depends on your cheek structure, and several other structures, the zygomatic arch, and we'll look at that. And so, sorry if you don't see your country represented, but you're going to fall into one of these 4 races. Because remember, after you pass away, your skin falls off, the color goes away, and all that's left is your skull. So they can use that to determine if you're male, female, and what race you are. So here's a typical Asian skull, the Mongoloid scale. Here's an African skull, Caucasian and European skull, and then here's more Aboriginal Australian skull. Okay? So you're going to fall, remember, when you pass away, all your hair, nails, skin fall away, so all that's left is the zygomatic arch, the maxilla, right, the superciliary arch. So these are what we can use to determine what race you were. Now, the notion that humankind can be divided along white, black, and yellow lines reveals the social rather than the scientific origin of race. Because look at this cute little kids. Fortunately, when they pass away, all their skin color goes away. So you're not going to be able to judge them based on white, black, and yellow lines. Okay, so wish more people understood this. Maybe we'd have a more peaceful society, but unfortunately not everyone gets to take this course, right? Alright, what are the functions of the skeleton? Well, we have protection of the heart, lungs, and brain. We support to maintain posture. The skeletal functions to movement by serving as points of attachment for muscles and acting as levers. Helps storage of minerals such as calcium and phosphorus. And hemopoiesis occurs in the vertebral bodies, femurs, humerus, ribs, and sternum. So hemopoiesis is the process of blood formation in the red bone marrow. What are the types of bones? Well, we have long bones, which are the humerus and the fibula. We have short bones, which are the carpals and tarsals. We have flat bones, which are ribs and scapula. We have irregular bones, which is ischium, pubis, and maxilla. And we have the sesamoid bones, which are the patella. Yes, people always say, hey, your last name is the name of a bone. Yes, I've heard that before. Again, I'm going quickly through this because you've had anatomy before, so this should be relatively review for you. Now let's look at the long bones. They're composed of a long cylindrical shaft with a relatively wide protruding end. You have the shaft that contains the medullary cavity. So what are the examples of the long bones? Phalanges, metacarpals, metatarsals, tibia, fibula, femur, radius, ulna, and humerus. And if you're looking at this and you're like, I don't know where the femur, radius, and ulna are, you might need to review that because I'm not going to spend time going over what these bones are. You should know that already. You've taken Kines 210 or Bio 210 and hopefully you learned all that. Oh yeah, that doesn't look right. Look at this guy. Yeah, that's not right. Now, if you look at this, these are the types of bones. These are short bones. They're small cube-shaped solid bones that usually have a proportionally large articular surface in order to articulate with more than one bone. And those are some carpals and the tarsals. So here's the carpal bone. Here's the talus, which is inferior to the tibia fibula. You have flat bones, which usually have a curved surface and vary from thick, where tendons attached to very thin. So here's the scapula. This would be a right scapula because you're looking at posterior in the anatomical position. Examples include the ilium, the ribs, the sternum, clavicle, and the scapula. So for the test, you're thinking, well, how can you ask this, Patel? Well, it's easy. I'd say all the following are flat bones except. All right, so you want to know the best way you have to think about how can I ask a lot of information is, well, the except is a good rule. Multiple choice is good. Matching is good. There's lots of ways that I can ask a lot of information in a condensed way. Even scapulas break. Look at that. This is from snowboarding. If you look at that right in there. So that's a fractured scapula. It's very rare, but this patient lost control and they ran into a tree. That happens, right? So there's a fractured scapula right there. Here's some irregular bones. If you look at the irregular bones, you have includes bones throughout the entire spine, and the ischium, pubis, and maxilla. Those are irregular bones. Then you have some sphenoid bones. So you're thinking, oh, where's the sphenoid bone? Well, if you remember from anatomy, you have the ethmoid bone, and posterior to the ethmoid bone is the sphenoid bone. Kind of looks like a bat. Okay. And what sits in the sella turcica of the sphenoid bone is your pituitary gland. So you remember pituitary gland, sphenoid bone. Now, sesamoid bones, they're small bones embedded within a tendon of a musculotendinous unit that provide protection and improve mechanical advantage of musculotendinous units. So the patellar tendon, right? So the patella provides a musculotendinous junction and improves the mechanical advantage of the quadriceps tendon. So that's that patella right there. Anybody fracture their patella before? If you land on your knee, you might have a fractured patella. Typical bone features, you have the diaphysis, which is the long cylindrical shaft. You have the cortex, which is the hard, dense, compact forming the walls of the diaphysis. And the periosteum, dense fibrous membrane covering the outer surface of the diaphysis. Okay. You have the endosteum, which is the fibrous membrane that lines the outside of the cortex. And then you have the medullary or marrow cavity, lies between the walls of the diaphysis, and it contains a yellow or fatty marrow here. Now the epiphyses appears at the ends of long bones, formed from cancellous, spongy, or trabecular bone. Now kids, they'll have an epiphyseal plate, or you've heard of the growth plate before. That's a thin cartilage plate that separates the diaphysis from the epiphysis. Now as a kid, you're going to continue to grow until about 18. Most long bones stop growing at 18, but your spine, your vertebral column, the vertebrae usually grow until you're 25. So really, you don't technically stop growing until the age of 25. Some of you, the epiphyseal plates have closed, unfortunately, so you will no longer get taller. You'll just get wider. I'm sorry, that's just the way it goes. Once you stop growing, there's only one way to go, and that's laterally. You no longer go superior, inferior. And now, but if you have an injury, you can actually, the epiphyseal plates due to trauma can close early, and if you have a severe fracture, you might have a leg length discrepancy, and one leg might be shorter than the other, or one arm might be shorter than the other because the epiphyseal plates closed early. And trauma can do that, so you have to be really careful of fractures to the epiphyseal plates. Now, bones also have articular or hyaline cartilage at the ends. Okay, and articular cartilage is like tread on a tire. You have to be real careful because you don't want that articular cartilage to wear off. So once it's gone, it becomes bone on bone. So you've heard of patients or athletes say, "Oh man, my knees are bone on bone." That's because they've worn out their articular cartilage. If you remember Kobe Bryant, rest in peace, Kobe. He had about 7 or 8 surgeries to remove loose bodies of articular cartilage in his knees. Right? Michael Jordan had the same thing. So any basketball player, they'll have tons of arthroscopic surgeries to replace. You can't really replace articular or hyaline cartilage. All they can do is clean up the knee, but you don't want to clean out too much. And we'll talk about meniscal injuries as well. Meniscus, if you tear your meniscus, if you're under the age of 25, they can do a repair. But after 25, unfortunately, they'll have to remove the small piece. You don't want to remove too much because it doesn't grow back. Bone growth. How do bones grow? Well, they develop from hyaline cartilage, and hyaline cartilage masses grow rapidly into structure as humans develop from an embryo. Okay. So that's why young kids, most of their bones are still hyaline cartilage, so when they fall, they don't end up breaking their bones as much because they're mostly hyaline cartilage. As they grow and it becomes more bone versus hyaline cartilage, then the rate of fractures can go high. So if you're working in the ER, if you're working in the hospital, and you see a child that's 2-3 years old with a broken bone, then we have to ask a question, well, what kind of trauma did they have to cause that to break? Because it would take a lot of trauma to break hyaline cartilage and bone. So unfortunately, sometimes we have to make sure we rule out abuse. Because it would be pretty blunt trauma that could cause that. Not to say that it couldn't happen, falling off a bike, falling off a table, that would cause a fracture, but when a young child comes into the ER with a fractured bone, we would have to ask several questions just to make sure that, hey, they're under good care. Now, bone growth, grow rapidly into structures shaped similar to the bones that they will eventually become. So there's very rapid growth. Now here's an interesting fact. I don't know if you remember how tall you were at the age of 2, but if you double your height when you were age 2 is pretty much how tall you'll be. So if you were 3 feet at 2 years old, guess what? You'll be 6 foot when you're completely done growing. So the first 2 years of life is very, very important. And the first 2 years of life, as far as nutrition is concerned, is very, very important. So when you're ready to have kids, make sure that the first 2 years you feed them healthy stuff. No garbage candy, Gatorade, sugary drinks, soda, and especially no soda. We'll talk about the dangers of soda in young kids at a very early age, because soda, especially diet soda, that's terrible for you. We'll talk about that. But it has high amounts of phosphorus, and the phosphorus will leach the calcium from the bones. Okay, so with that, let's take a little break,